Now, the second main area that I want to think about inequalities and how they impact BAME communities is thinking about health inequalities. Now, we've seen this impact more than ever before during the COVID-19 pandemic. And if you have a look at that infographic that I've given you, you can see that people from BAME communities have been increasingly impacted over time, and way more seriously impact, particularly when we look at deaths, than white communities. And one of the biggest reasons behind this is to do with the kind of employment often held by people from BAME communities. They are much more likely to be in jobs where they are what we call front-facing. So whether that's working in the NHS, whether that's driving a bus, whether that's working in supermarkets, they're working in jobs where they can't work from home. So they're far more likely to be exposed to COVID-19. There's also issues in terms of access to healthcare. We know that BAME communities have less good access to healthcare than white communities in terms of GP practices, in terms of out-of-hours services. All of these factors they're much more likely to affect BAME people, because we know that people living in more deprived areas are twice as likely to die from COVID-19 than those living in less deprived areas. And we know that people in BAME communities are more likely to be based in these deprived areas than white people. But setting aside COVID-19, we actually know as well that BAME people are less likely to be healthy than white people. By that, I don't mean they're less likely to go jogging, they eat differently. No, what I mean is they're less likely to have good health later in life, but actually throughout their lives. And there are significant variations between different ethnic minority groups. We can see in both men and women, but the most noticeable difference is between older women. 56% of all women aged 65 or older report a long-term limiting illness. So that could be something like dementia, but it also could be arthritis. It could be any number of diseases that we tend to think of as being diseases of old age. So the norm for all women is 56%. But when we look at Pakistani and Bangladeshi women at this age, it's much more likely to be 70%. 70% of women, Pakistani and Bangladeshi women aged 65 or older, report a long-term limiting illness. Again, the differences are worse in northern and in poorer areas, so we know that this is something to do with socioeconomic status, but actually across all socioeconomic groups, people of colour have poorer health than white people. All right, there's a huge inequality there. In 2016, a study was found, it was really shocking. Black, African and Caribbean communities in London are exposed to higher levels of air pollution than white London communities. The study for the Mayor of London found that levels of the harmful gas nitrogen dioxide, which, kills people, were far higher in majority black areas than in majority white areas. Now, that's not to suggest that somebody is going around to these areas and deliberately spraying nitrogen dioxide, but it does suggest that that different communities are, councils, etc., are not prioritising traffic control measures. They're not taking the health of those communities seriously. It might also suggest that the white communities have a bit more power to demand changes and things like that. But we can see that there is something there. Nitrogen dioxide can lead to serious breathing problems, long-term health problems, and it is undoubtable that in London in particular, African, Black and Caribbean communities are more exposed to this deadly gas than white communities. Now, collectivists, again, we would be talking about systemic inequality, and that puts BAME people in harm's way. So they would point out that during this pandemic, BAME people are far more at risk of COVID-19 than white people. And this is just a continuation. This is not a new thing. And as we said earlier, they'd say, well, it's because they're more likely to be in jobs that had a high risk of contracting coronavirus. But it's also to do with the lack of healthcare and the lack of support for BAME people, and also the precariousness of employment for them. If they are in a situation where they'll lose their job if they don't turn up to work, well, if they've got COVID-19, they might still turn up to work because they can't afford to lose their job. But individualists would say that it's difficult to separate out the impact of being someone from an ethnic minority background from the general impact of poverty. So they would say, well, you're saying that people of BAME, Black, Asian and minority ethnic people, are suffering from worse health than white people, but actually individualists would argue, no, you're conflating. That means getting two things confused. You're conflating two things here. It's actually that because people from ethnic minorities tend to be poorer in general than whites, that is the situation that's happening here. It's about poverty, not about race. There are some arguments that certain races are genetically predisposed to poorer health or particular diseases, or are more likely to make unhealthy life choices, particularly around diet, but there's not very much evidence to support this, and a lot of the evidence that there is seems to be based on kind of people looking for evidence to support stereotypes that they already have. So, for every study that shows that particular cuisine is less healthy, cuisine from a particular area of the world is less healthy than, standard white English fare like fish and chips, we ignore the fact that the consumption of alcohol in white English groups is much, much higher and much more damaging than in other ethnic minority groups. So that we should definitely be wary of any study that suggests that one ethnic minority group, one ethnic group, one race is predisposed or makes better lifestyle choices than others, because usually it's just racism.